I'm going to need you to impart a little bit more knowledge as we take some questions from our audience all across America. We have one really good question. Um, this is from one of the viewers who says, one of my concerns about community-based early education is the highly variable level of training and skill of the community-based teachers and paraprofessionals. What are your thoughts on the skill and training level of early education professionals? You want to take that, Dr. Iruka?
Sure. First, I want to sort of really acknowledge our vast and diverse childcare, early childhood workforce. And while I definitely, in some ways, agree with what the audience member sent, I think we have to realize, again, the context in which many childcare providers are under, right? We are again paying $11 an hour for a workforce member who is likely not getting benefits. And so if we think about just that, but we're also expecting them to also get a BA degree and then make $11 an hour. So we have to put the whole entire childcare context um, into sort of a clear picture. And so I would say that there's a lot of things happening now with the childcare community, and we have to realize that some things just take a little bit more time. So, for example, we know the National Academy's report several years ago really said that every child needs to have a highly competent, highly educated workforce from prenatal all the way through at least age 8. And so that means that there's a movement to ensure that everybody from the community-based childcare provider, infant toddler teachers, pre-K, et cetera, that they at least have a minimum of a BA degree. However, to get there, we have to actually be able to pay teachers and reward them for going to school and getting a BA. And we can't put the cost of that on the backs of families who are already paying a lot of money for childcare. If you think about it, many families pay more than a 4-year college tuition for childcare, especially for infants and toddlers. So I think, yes, while the childcare community, early child education could do better in terms of ensuring quality is consistent, which is happening across many states through rated license systems, through quality initiatives. HighScope has a profession coaching learning system that also connects with a lot of different providers. We do understand that when you have a system that is not fully funded, you can expect that there may not be the most perfect education opportunities. We want to also acknowledge that childcare providers, early child providers, are expected to do much more than they're paid to do. And so we can't criticize that much if we're not investing wholeheartedly in the educators themselves and also in their health and their well-being, because the best teachers are those who we take care of.
The only piece I would add is that as a public policy measure, the responsibility should be for state and local and employer-based investment in childcare, particularly for our small home-based facilities. Sometimes the solution is not to tell the woman who's been providing these services for 40 years to go back and get her BA, but it is to say that we're going to help her hire a paraprofessional who has that educational expertise to support the work that she does. And so to Iheoma's point, we have to think about a way to meet the point of need now and build toward the best solution in the future. And that doesn't mean that we dismiss the need for quality education right now in home-based facilities, but that we solve the problem as we do for almost any other challenge we face. But that's a public policy requirement. And that means that we have to recognize that parents cannot afford to subsidize childcare on their own. That means that there has to be state and federal investment in the provision of those services. It means that we also have to plus up, as I've said, we've got to raise wages, increase access to benefits, because we also have to start to attract new people into the profession. And they're not going to come if they don't believe that they can make a living or make a life doing this work. But we also have to meet people where they are. And that means understanding that in rural communities and communities that have mixed documentation status, that in places that have no public transportation, or in places where the entire community is basically bound to one area and they don't have the ability to travel outside or to get access to higher quality, that we have to build quality where we are, meeting people at the point of their needs and making the investment in those businesses that will also augment and improve the education of our communities.
One more live question from our audience. People want to get involved. The question is, we know the research, short-term and long-term outcomes of high quality education, but how do we shift the early childhood education issue in this country to make it a priority? How do we make it a priority? I think, Stacey, maybe this goes to the point you made about voters making this the voting issue for themselves.
When I ran for governor, I was the first candidate that we can find who actually made childcare and early childhood learning a focal point that was a standalone. It wasn't just my education policy. It wasn't just a workforce policy. It was a specific policy that looked at this issue. And I did it in part because before I ran, I spent 11 years in the legislature in conversation and in battles trying to ensure that this service was provided, that this educational necessity was recognized by my colleagues. I had done work as a consultant helping build an early childhood learning program. I did work as a legislator, and it, for me, as a candidate for governor, was top of mind. But one of the ways it stayed top of mind was that those who needed it asked me about it. At every campaign stop, at every moment, I got a question about, what are you doing on this issue? I started the conversation, but they held me accountable. If you don't have legislators, if you don't have public officials who are willing to start the conversation, start it for them. And the way we start it for them is not simply by asking them directly, but also asking on Facebook so other people can see the conversation, tweeting the question at them, using social media, convening meetings, and inviting them to come to address the topic. And the reality is, if you invite someone to come and talk to you and they don't show up, that tells you something. And so part of the convening capacity in the midst of COVID-19, in the midst of this election season, is that communities have the authority to bring people together to hear the questions that need to be asked, but they also have the right to ask those who currently hold leadership or want to hold leadership to come and participate. Zoom works for everyone. So to Google Hangouts, you name it, there's a way to do it. And we should be able to request of our leaders that they show up at the local level, at the state level, and at the national level to answer our questions and to tell us what their plans are. Because it's not enough to nod and say, I get your pain. I need you to tell me what your plan is to resolve it.